um, there we go. Because many of our members have gotten in contact with us and let us know that because it happens during the day, they're unable to join us. And so this will be posted to the BRA Group's website in a couple weeks, and people will be able to view it back so they can get this really important information. So we appreciate you bearing with us on that. We are a Nashville-based nonprofit that offers programming to people in the breast cancer community. Our programs include physical strength, nutrition and education, and small group discussion. And so if you would like to know more about our programs, we'd love you to check out our website or to reach out to Jahan or myself through the chat, and we'll get back in touch with you with more information. As a matter of housekeeping, we would appreciate it if everybody would mute their microphones during the presentation so that will avoid some background noise. If you would like to ask a question, we encourage you to do so. You can ask a question through the chat or by waving, and when we see you, we'll make sure that Jill, our speaker today, can get to you. And we do really encourage you. This is BRA Banter. We try to be informal here. So we do want to hear from you if you have any input, but we do try to be respectful. So please mute your microphone. And with that, I will turn you over to Jahan.
Hi, as Lynn said, my name is Jahan Corbin. So excited to see you all today. Welcome. If I haven't met you in person yet, I hope to do so in the near future. I have the privilege today of introducing our guest speaker. Jill Myer-Lippert is a registered dental hygienist and has been in dentistry for over 30 years. And she is the founder of Side Effect Support, which is a really amazing company. I'm going to let her explain more about what they do. And I think you'll hear from her just how passionate she is about it and kind of why she got into this business. But they're offering some amazing resources. And Jill is the recipient of multiple awards and distinctions. In 2022, she was named one of the 6 dental hygienists that you want to know. So we feel super honored to have her. She is located in Wisconsin, and I asked her for a fun fact, and she told me that she and her husband love walking shelter dogs with their local humane society. And she actually linked us to her husband's business that she does a lot of social media for, and she started promoting some of the shelter dogs that are up for adoption and helping them find forever homes that way. So I thought that was really cool and a super fun thing that she does over the weekend. And it just so happens when we had our pre-banter prep call with Jill, it was one of those days when Lynn and I were both working from home and just had all the things going on, and my dogs were going crazy. I have an older dog and then a puppy that we got at Christmas. And so Jill quickly was like, "You're among friends. I'm a dog person too," and just put us at ease. So I think that was a great thing to have in common. So Jill, we're so appreciative of your time today. Thank you for being here. And with that, I would love to just turn it over to you. And kind of the first question is, please just tell us about Side Effect Support and how it became so important to you and why you started the company and what you guys do.
Sounds good. And I really appreciate the opportunity to be here and spend time with you all today. But so yeah, it's kind of been a long process. I started my first job in the dental field back in 1992. And my mom was diagnosed with breast cancer at that same time. And watching her deal with the oral side effects, I mean, she had all sorts of side effects from her chemotherapy, but a lot of problems inside of her mouth. And it was so frustrating to me that it just felt like she wasn't getting help from her medical team on that. And now that I had just started working in dentistry, I thought, oh, I'll easily be able to find all these answers for her. And then reality kind of bonked me upside the head and said, that's not going to be the case either. So I realized there was not only a lack of resources and information from a patient and family caregiver perspective, but also for us as healthcare providers. And it just seemed like there's such a lack of care in this area. And it really snowballed through the years that I wanted to find some type of a resource that would provide me all this information I was looking for. And I couldn't understand, why doesn't this exist? And years later, all of a sudden a little voice entered my head and said, well, you know what? maybe you need to do this. And of course, that was very daunting, the thought of creating something like this, but that's what it's modeled after. It's an online resource that is made to provide free and easy to access information in layman's terms for patients and family caregivers, and more technical information for healthcare providers. And then I have a little over-the-counter online shop that has oral care products that can be vetted in some way that, I know that they can not only hopefully minimize some of the side effects, but then protect long-term oral health in the process. I actually partnered with a teledentistry company so people can access a teledentistry visit directly from my site, and partner with other companies to offer expanded products and services that people might just not realize are available. And I'm always very conscious of the financial strains that come with a cancer diagnosis, from my mom's experience and from my dad's experience, that I'm always trying to finagle discounts for everybody on any of those things too. So just helping to hopefully make the process a little less scary, and empower people to be able to have more control over the whole situation.
I love that. And so you kind of started it as a side hustle, right? While you were still working in clinic, and you sort of added and then just built this website?
Yes.
That's
yes,
great.
I launched it in 2013, and I continued to work full-time clinically in the dental office until the fall of 2019. And since I've been able to transition out of the operatory more, I've been able to focus more and expand its reach, and let people know that it's there and available.
I love that. We're so glad.
It's great. And I wanted to let everybody know that when the recording goes up on the BRA Group's website, we will have a link to Jill's website. And so
Side
you
effects
can
support.
click through
Mhm.
to it easily. Okay, so one of the first topics that we wanted to talk about is dry mouth. So during our prep call, we were talking about this a little bit, and it can impact people who are both going through treatment and people who are post-treatment, right? And I believe a couple of the different causes that we had talked about were during treatment. Many of us are prescribed like anti-anxiety medications and treatments for depression. So can you tell us a little bit about your thoughts on that?
Sure. Yeah, dry mouth is just a huge problem all the way around. There are just countless number of over-the-counter and prescription medications that have dry mouth as a side effect, and especially with cancer treatments, not only with chemotherapy. People kind of know that that's usually part of it, but there's all those extra things that you don't always make that connection with. And like you mentioned, those anti-anxiety, antidepressant medications often have dry mouth as a side effect. And then every time you keep adding more medications that have that risk, you just keep compounding the issue. So sometimes people, just have such a dry mouth because they're taking all these different things that cause it. So that is one that, and actually some of the anti-anxiety, antidepressant medications can have a really unique side effects where they can sometimes make people clench or grind their teeth a little bit more. So all of a sudden people may notice, oh, I'm having a little bit more like jaw strain or headaches, or, all of a sudden they're just putting that extra pressure on their teeth. And that sometimes can be a really unique side effect. There's not a lot of medications that actually have that.
Really? Interesting.
Mhm.
I didn't realize that could be tied in.
Mhm.
And then what about post-treatment when women are put on like hormone suppression?
Yes. So all those hormone suppressing medications kind of push you into that, like a menopause type of a situation, and dry mouth can be part of that as well. Sometimes even people may experience what they call like a burning mouth syndrome, where they get a kind of a burning in the tissue, and that sometimes can be tied to hormones as well.
We have a comment in the chat from Candy saying that some of the medication, or one of the medications, okay, wait a second, did I just lose it?
Yeah,
Um,
has put her into
that has
diabetes.
put her into diabetes, and that she can tell when her mouth feels really dry that her sugars are up.
Yes, that diabetes is something that has a very reciprocal effect with oral health and with dry mouth that, unfortunately, anybody with diabetes is more prone to having problems inside of the mouth, including dry mouth. And the more inflammation or disease that occurs in the mouth, it actually makes it harder to keep the blood sugar levels under control. So that can be a tricky one sometimes.
It's amazing how interconnected all this stuff is. We're going to get a little bit more into that later on our call, but I think that's what's so fascinating to me about this topic is just how indicative oral health can be with other things and vice versa,
Yes.
I actually have a follow-up. So you mentioned that part of the connection between the hormone suppression and the dry mouth is going into menopause. So would it be typical for a woman who's not on hormone suppression, who's just naturally going into menopause to have dry mouth issues, do you think?
It can be. It's not uncommon. I'll say that. It doesn't affect everybody, but yeah, it definitely can be even without a cancer situation.
Oh, really? Interesting.
Well, I mean, that makes sense. It'd be dehydrating kind of all over sometimes, your skin and stuff.
Right. There is no end to the issue.
I mean, I'm going to say, just keep the gift that keeps on giving, isn't it?
Yes.
Okay, so I know you mentioned we were talking about hormone suppression with relation to dry mouth, but we also know, a lot of us as breast cancer survivors, hormone suppression and also some of the steroids that we take during treatment can really impact bone density. And these can cause dental issues as well. I wondered if you could expand on that.
Yes. So for anybody that goes to the dentist regularly, typically you probably are getting those periodontal readings where they take that little probe and they put it between your tooth and the gum tissue and call the numbers off. What they're looking for is signs of gum disease or periodontal disease. And our teeth are held in place basically by a bone structure in our jaw. And sometimes when you have bone mineral density issues, it can make you more susceptible to having some bone loss in those areas too. So when you start having that loss of the support structure of the teeth, that's considered periodontal disease. And definitely those medications can make it more likely for that to happen. So it's a little trickier sometimes to keep the gums healthy.
So do you have any recommendations for women who have gone through treatment, whether, they are on hormone suppression or if they had active chemo and likely were given steroids in terms of what they should do in order to help prevent any gum issues?
A lot of that is going to be your home care techniques, really keeping your teeth as clean as possible. Through your brushing, your flossing, your water flossing, or whatever you choose to use to clean, in between your teeth, because the more plaque that builds up or the more tartar buildup, it does make it more likely that you're going to have some issues with that. So, so some of this just staying up on your home care, seeing your dentist on a regular basis. Sometimes people, kind of the general rule is people will say, oh, you should go every 6 months. And some people need to be seen more frequently than that. And part of that may be to help keep those pockets between the tooth and the gum tissue cleaned out well, that it doesn't have a chance to, start in type of a further progression of the disease. And so that can be a big part. If you are a clencher or grinder, like let's say if you are because of an anti-anxiety medication, or sometimes it's just a stress thing. I mean, I know for myself, sometimes when I'm stressed out, I carry it in my cheek muscles and I will wake up. Sometimes I'm like, oh, why am I clenching? Sometimes it's having some type of a little mouth guard that you can wear at night that'll help to put some cushion on between your teeth to help protect them as well. And that helps to maybe not put too much pressure in certain areas that have affecting the bone. So those are probably some of the biggest things, but you might be surprised that one thing to avoid doing is there's a lot of mouth rinses out on the market that are real strong ones that are meant to be like killing all the germs, they're antiseptic. You really shouldn't use one of those long term. If you use one for a short term, 2 weeks or so, after that, if you use it too long, what happens is you're not only killing those bad bacteria in the mouth that cause problems, you actually start to take away the good bacteria as well. And there's certain bacteria that we need in order to have a healthy mouth. So we don't want to get in there with this theory of we're just going to kill everything off, because if you take away that good bacteria, then it's harder to keep a healthy state in your mouth too.
Hmm.
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 And then if I was like, say, to connect in dry mouth with gum health, like, can dry mouth cause any gum issues? Because it seems like that
Yep.
wouldn't really be good for your mouth to be dry all the time, right?
Right. Our saliva is actually really amazing. It's got really healthy elements in it that help to protect your mouth in so many different ways. It protects it against infections, and it helps to coat and lubricate the tissues to reduce mouth sores or risks of those. It helps to remineralize your teeth to prevent cavities. And, it just has all of these great benefits. So that's where dry mouth can really be a tricky one, because if we can get that under control, you can really help to minimize so many other risks inside of the mouth.
One of the questions related to this, Jill, coming in is there anything we can do to increase saliva or production of saliva?
There are there's many different oral moisturizers on the market that are there's gels, there's sprays. There's one that I like too, that it's a little disc that can adhere up inside of the cheek, and it gives more of a longer relief of it. And if you have certain ones that have like a sweetener in them called xylitol, that can actually help to stimulate saliva, and it can help to reduce your risk for cavities as well. So there's some products in the market that are made for dry mouth, but not all of them are good for your teeth. Sometimes they're acidic. And then with long-term use, that could potentially start causing damage for your teeth as well. There's some prescription meds as well. I would say, the prescription sprays or things like that, there's some good options there. But then there's some that come in like a pill form that can also have their own side effects. So I think if you can not go to an actual medication to do it, especially in a pill form, that is a nicer way to go, that you're not just masking one problem to have another problem caused.
Yeah,
Right.
yeah.
You had mentioned that on your website, you have some product recommendations. Do you know if you have any of these items linked on your website?
Yes. Yep. I have an online, it's a little shop tab. And there's a section of oral moisturizers that you can kind of see what different options are. And there's certainly more options than what I have on there too. But these are ones that I seem to get some good feedback with and enjoy myself using them.
Yeah.
And like Lynn said, we will link her website on our blog post, but it's sideeffectsupport.com, right, Jill?
Yes.
Sideeffectsupport.com.
Yeah.
So you can go and look on her online shop there. We also have a question about from Candy about I may butcher this pronunciation, so please forgive me, but I have dexamethasone for mouth sores. She was wondering, should she use this before or after she brushes?
That if it's being prescribed for mouth sores, you're probably going to get the best effect by using it after you brush. Just because otherwise you're removing things right away. And this is something that, that's going to be more of a short-term usage too, that if it can get you through that feeling of the soreness and keep you comfortable, that's going to be the main thing for that.
Okay, thank you.
Well, actually, so the mouth moisturizers, are those products you can use long-term, as long as we're talking
Yes.
about duration?
Mm-hmm. Yes.
Okay.
We were talking about gum health before. I know we're jumping around a little bit, but we want to make sure we address the questions that come up in the chat as well. So thanks for ping-ponging with us a little bit. I will just be honest, in a effort to be totally transparent, I am a horrible flosser. My dentist knows this. My family knows this. Everybody knows this. I get reprimanded every time I go to get my teeth cleaned, which is twice a year. I'm just curious, but I do know, and I am learning that it really is important. So I'm trying to be better. So I just was curious how long, if I continue to do it regularly, how long is the bleeding going to last?
Well, I typically, if you're doing it on a regular basis, that bleeding should stop within, I mean, within a few days, maybe a week, and at the most, unless there's something underlying. If you would be doing it really faithfully for a while and it's just not getting better, that's when you'd want to talk with your dentist a little bit more about it. But it's really important to use the proper technique with it too, where a lot of people, I might just to see if I have floss here, I can show you.
Yes.
Not everybody flosses correctly.
Hmm.
You know, so often you'll see in different times, they show like people going up and then just seesawing. And that's actually not where you get the best effect, where if you take about an 18-inch strand, and this is pretty thick, so it's going to be easier to see, and you take your middle finger and you just wind it maybe like once or twice around the middle finger of one side, and then take the rest and wind it around the middle finger of the other side. That's going to give your pointer fingers and your thumbs to use more of extensions for reaching in between the teeth. And then once you get in between the teeth, once you break through that contact, you want to take the floss and curve it really tight, like a C shape around one tooth. And then you can go kind of up and down, that you're mechanically scrubbing that whole inside edge of the tooth. And as long as you're curving it tight, you'll be able to slide that right underneath the gum line where that pocketing occurs. And then once you get that tooth done, you curve it to the other side, and then you go on the inside edge there. And once you use this area, then you can wide that used part around and keep kind of scooting down as you go through your mouth to make sure you're using a clean piece of floss each time. So the more you can get that curvature, the better, versus going kind of straight in there. And that's going to help that you don't cut into the tissue too.
I don't know that I've ever heard that or been taught that. That's really helpful. Yeah, that's nodding like that. Maybe the first time I've ever heard it, and that C for it sounds like it'd be less irritating too.
Yes. Yeah. So sometimes the bleeding can come just from not using quite the right technique with it too.
Yeah. All right.
We got a couple
questions.
in the chat. Let's
This
see.
is the first one was about fluoride from Maren.
Yeah.
Let me scoot up here. There we go.
All right. Does the fluoride swish after a cleaning at the dentist office give enough? And is it long-term? Also, fluoride rinses seem to include alcohol, sometimes as a first ingredient. Is that not counterproductive for those of us with dry mouth?
I would say it is counterproductive. Anything with alcohol in it is just going to be drying for sure. As far as the fluoride swish being used at the dental office, there's different concentrations of fluoride. So the fluoride that you get in your toothpaste, that you buy at the big box store, has a weaker concentration versus a prescription kind of fluoride. So the higher the concentration, the more effective that it will be. As far as a swish afterwards, I can't say exactly what that office is using. It's not going to be an incredibly long-term effect. I would actually suggest there's something called a fluoride varnish that can be applied at the dental office, that it's just like a little jelly, and they take a tiny little brush, so it looks like a paintbrush, and they just paint that right on your teeth, and when it mixes with your saliva, it hardens on there. And that actually gives more of contact time, because the more it has contact time, that helps to keep kind of soaking up in those areas. And then there's also the prescription. They can make it to put in a tray that you can wear, or they can give you a prescription brush-on gel as well that you can use before going to bed at night. And sometimes what you can do then is just brush the prescription toothpaste or fluoride over your teeth, spit the excess out, but then don't rinse after. And then again, you're getting a little bit more contact time on the teeth.
Okay.
All right.
We've got a question in the chat about water picks. Somebody that's got one that has never used it and really doesn't know how to use it. Tell us about the benefit of those, and why should we or should we not be using those?
Actually, I really appreciate this question, because on the side of side effect support, or in addition to, I'm a professional educator for water pick in our area.
Wow.
So I do lunch and learns for dental offices in our area. And of course, I am a huge fan of water picks and water flossing. It's something that is just an easy way that you don't have to be as technique sensitive with it. That really takes some coordination and practice with your regular floss. I would be curious if you got a water flosser, Jahan, that if they would notice if you came back in and they're like, oh, is there an improvement? That
okay.
But
So
there's
you
different
use it
models, there's
instead of
different
flossing?
features.
I'm sorry, I talked over you. You use it instead of flossing?
You can. You
Really?
can. There's different studies. I mean, there's studies that are showing that using a water flosser at least a medium pressure. And I can't say all brands of water flossers because the only ones I know about are the studies with the Waterpik water flossers that they can move up to 99% of the plaque biofilm on the both the outsides of the teeth and in between the teeth. So that's a great way to help keep your gums healthy. The one thing is just to keep in mind, if you are in the middle of the treatment process, no matter what, if it's regular flossing, toothpicks, water flossing, anything like that, that always has to be done in respect to your blood counts.
Mhm.
If your white counts or your platelets drop too low, your care team may tell you that you need to just not do that until they come back up into a safer range, because you just might be more prone to uncontrolled bleeding or more prone to infection, things like that. So they want to try to keep that like bacteria flow or the prevent it from getting stirred up too much.
Yeah, that's a great point. Well, and I was going to say, I haven't tried the water flossing, and maybe my dentist would notice a difference, but I will say a few years ago, they finally convinced me to go to a electric toothbrush, and that made a big difference. I mean, I think my teeth, I was able to get a much better clean with an electric toothbrush. So,
But in terms of learning how to use it, do you have any suggestions? Like, is there YouTube videos Candy should check out, or?
Oh, there are actually some videos, but in general, if you take the tip, there's one tip that's called the classic jet tip that comes with all water flossing models. I personally prefer the countertop models versus the handheld. Those handheld models are a little bit more technique sensitive, in my opinion, but the countertop models are a little bit easier. That if you just start, let's say you start in the upper right around that last molar and you point that jet tip at about a 90-degree angle and you just scallop along the gum line and you pause for about 3 seconds each in between each tooth. And you can go around and do the face sides, go back through, do the tongue sides, and then go down to the bottom and do the same. And ideally, you want to get up to at least a medium pressure, but for some people that are just starting to use it, that might be a little too, it might feel too much until their gum tissue gets a little healthier and is able to withstand that, I guess. So if you need to start out at a lower pressure until your gums feel good with that, you can slowly start moving that as time goes on too.
Okay.
okay, we have a question, Leslie. If you want to unmute, she has got her hand raised. I think she wants to ask a question. You're up, Leslie.
Thank you. And this one was a little too convoluted to type out. So I don't currently have any dental issues that I know of, but I'm a member of a number of Facebook groups. And recently there have been a lot of comments from people who've said, chemo, the gift that keeps on giving, having to have 4 teeth removed today. And all of these people chiming in like, oh yeah, I finished treatment 5 years ago or whatever, and I've had to have all of these teeth replaced and that kind of thing. And I'm only less than 2 years out from my treatment, and I'm starting to freak out thinking, well, what? I don't know what happened to these people. They never really say, but is there anything you know of that I need to be concerned about that 5 years from now I'm going to have teeth removed? Or, I mean, do you have any insight into that at all?
Sure. Unfortunately, a lot of times people are going into treatments and they already have some problems going on. And then once they're in treatments and their immune system is suppressed, the dry mouth occurs, things can start to snowball for them. And so I'm glad that you didn't go in with any problems, but it'll be and being now that you're past treatments too, it'll be important to have that conversation with your dentist. Number one, that they're aware that you had this treatment done, and then just making sure that you see them on a regular basis. That if something is starting to show signs of becoming more susceptible to cavities, or, you know, your gums are getting a little affected, I guess, with the support structure, something like that, that it doesn't get to the point of getting too far progressed before it's addressed. That's the one thing with seeing a dentist. It's so important to have that preventive care and see them on a regular basis, that sometimes people will, you know, not everybody likes going to the dentist, let's face it, you know, and people will maybe drop off from going to the dentist for a while, and then all of a sudden a problem occurs. Well, then they'll go in, they'll see the dentist, they'll get the problem fixed, and then they maybe get overwhelmed and they drop off again. And then it's very hard to ever kind of get everything under control that way. You really need that consistent preventive care to help avoid a lot of issues down the line. So I hope that answered it. I'm not sure how well that was.
Well, you know, like I said, nobody was particularly specific. So my question really is, you know, and everybody's got a different treatment plan. And I think people outside the breast cancer realm don't understand that not all breast cancers are the same. But is there a component of chemotherapy that affects your teeth other than because of dry mouth and normal decay? Because one of the things they were saying is, oh yeah, all of the roots of my teeth shrank and stuff like that. I'm like, I don't get it. I mean, if it's just regular tooth decay, okay, yeah, then I'm not going to worry, but I'm starting to worry that there was a component of the chemotherapy or the immunotherapy that affects your roots or anything like that. I'm not on a hormone suppressor, fortunately, but maybe estrogen blockers also affect teeth. I don't know. Do you know of anything?
Estrogen blockers definitely, kind of like, you know, we mentioned before about a lot of times that can affect dry mouth issues. And of course, the drier your mouth is, the more susceptible you are to cavities and gum disease and things like that. And then I would guess, though, that if they're talking about their roots shrinking, there's nothing that I know of that actually affects the structure of the tooth like that they would actually have roots shrinking. I'm guessing they're probably dealing with a periodontal issue, a problem with the support structure. And they're probably talking about like having more of that pocketing and stuff like that. Sometimes it's just going to be a little bit of a translation issue. I think that whether they're maybe not having it explained really well through their dental provider, or if they are not really understanding what the issue is, that's the hardest part sometimes, is not everybody, when you don't speak that language, it's hard to describe it well and then really be accurate, I guess, with what's being described. But no, there's nothing that I'm aware of that would actually like shrink your roots at all.
Okay, thank you. I guess I just need to, you know, wait and see if there's ever an issue. But I mean, I continue to go to the dentist through my treatment. And so, yeah, it could be that these people didn't really have the best oral health to begin with, but it was really starting to freak me out.
No,
Well, for what it's
understand that.
worth, Leslie, I'm 6 years out, and I think a lot of those Facebook groups, they're super helpful for a lot of reasons, but then you do have some of the most rare cases, and those tend to be like the most, you know,
Worst case scenario.
worst case scenario.
across the
They
board.
tend to be the ones that sort of speak up the most or whatever. And I had to sort of be like, okay, I think if I'm fine, I'm just going to need to stop reading these because I feel like I'm fine. You know, sometimes you just have to, you know, recognize it's not going to be your path or whatever. So
It's a mixed bag.
yeah.
Yeah. All right. Thank you.
So we have several other questions that have come in on the chat. The first one about, do you recommend, Jill, using a gum stimulator to keep gums healthy?
I'm assuming that means there's these little rubber tip stimulators that can that are just another tool that can be used. So it depends on your particular situation, but those can be helpful for people too.
Okay. There we go.
There you go. Mary, do you want to chime in and tell us if that's what you were referring to? Yeah, she nodded. Yes, it is.
Okay.
Okay. All right, good.
All right. Sorry, we lost, we had one from Candy about a drug. Sorry, our chat is acting funky today.
Here,
Or
hold
maybe
on.
it's the
I
user.
can see it actually.
There we
User
go.
error. There you go. Okay. Received the infusion for Zometa to help reduce bone complications caused by metastatic breast cancer. And she's heard that it can cause a lot of issues with the teeth and the jaw. Do you know about Zometa?
Yes. So Zometa is a medication that's considered like a bone modifying agent. So it helps to maintain bone strength and bone integrity. There is a side effect that it's rare, but it's real. It's called osteonecrosis of the jaw, where the jaw, and I hate to use the words that it means, but when you break down what osteonecrosis means, it means death of the bone. So what can happen is the bone that holds the teeth in is very vascular. It has a lot of blood vessels in it. And when that bone is being now, it's building, the medication helps that bone build more rapidly. Sometimes it's not able to build the same blood vessels that it would otherwise. So if now that bone would be injured in some way through like an extraction, that's probably going to be one of the main reasons. Like if you have to have an extraction of a tooth or something that would damage the bone like that, it doesn't have the ability to heal properly. So then that's where that risk comes from. So anybody who's taking any of these medications, and I see there's another one coming about like Fosamax can carry that risk as well. So it's good that your dentist, number one, needs to be aware of it, and then to take is just as good a care of your teeth as possible. You want to avoid needing an extraction or anything like that. Or if, let's say, a tooth would break and they recommend a crown on the tooth to save the tooth or a root canal, that's going to be a far superior option versus taking the tooth out in order to help avoid that risk. And if you would have a problem that it's like, oh, I need to have this taken out, there's just no other option for this tooth, that would be where you don't want to have that. You don't want to have your just general dentist do that at that point. It would be wisest to go to an oral surgeon that has some special experience with that. So, and that way they can take just some extra precautions to help minimize your risks.
Okay, great.
We've got another response
Wow.
from Leslie about talking about the Zometa. I take Fosamax instead of Zometa and take Caltrate D along with it because her mom got osteonecrosis in her jaw from long-term Fosamax usage 20+ years ago.
Yes, that is another one that can carry that risk. Typically, the risk kind of goes along with how potent the dose is and how long it's used. So they say kind of like a time dose relation according to how much at risk that you are for that. So a lot of that is, again, just keeping things as healthy as you can inside of your mouth, doing it gently, knowing the signs and symptoms. So if you would notice something that's starting, like all of a sudden you feel a little strange area on the bone ridge, or you start having some strange odors, taste in your mouth, feeling loosening of the teeth, things like that, that you would have that evaluated right away. And again, probably having it evaluated with an oral surgeon who is experienced in that, because the sooner that they can address it again, and that's going to help give the best result with trying to get that under control, versus if it keeps progressing, then they get more limited on what they can do.
Okay.
I am fascinated. I'm learning so much from you. I feel like this is just something that we don't hear a lot about. I don't know if it's just because when you're going through treatment, there's so many irons in the fire, so to speak, at that time, but I really am glad to know more about preventative and taking care of oral health after treatment, which brings me to our next question.
Oh, wait, Rita, I think, were you
Oh,
trying
I'm
to get our
sorry.
attention?
Oh, I'm sorry. My
Yeah.
bad.
Go ahead and unmute, Rita.
Did you unmute? We want to hear you.
Oh, here.
I don't know if we can do it.
There you go.
All right.
Go hear you.
Actually, I was replying to Candy's message, and I'm happy to share with all. I had to go off X because of a problem with a root canal that was about 20 years old. And so I went off Fosamax and was concerned about that. And then recently, one of my molars cracked. And so I've been back to the periodontist. And yesterday, my concern has always been not osteonecrosis as well. But yesterday, the periodontist said the risk of osteonecrosis is about 1 in 10,000. So Jill, and that was comforting to me. You know, you don't want any of it, but you sure don't want osteonecrosis. So Jill, does that sound about right to you? Not that I'm doubting him, but
I would have to look up the most current statistics, to be honest with you. I know it is rare. It isn't something you see real often, but it's one of those things that it's well worth doing whatever you can to avoid it. I guess maybe that's the best way to say that. So I know sometimes I do believe that some of the cases are growing because there's more and more medications that are coming out that are considered targeted therapies that are showing to have that risk. So it just depends on, you know, what types of meds they are. And also, you know, it's somebody, again, that's where there's such value that if you go into these treatments already having a healthy mouth, you're at such less risk for any of these problems happening versus, you know, if you already have some oral disease, infection in place like that, that's where people become more at risk for that.
thank you.
You're welcome.
Okay.
All right.
So we have got, I think we've got about 15 minutes, about 12 more minutes. So we're
Okay.
doing great.
Wait,
so-
Candy, I think
Candy's-
Candy wants to pipe in.
Go ahead,
on
Candy.
mute. Go ahead. Oops.
We're trying to hear you.
We don't hear you yet.
Okay, I'm
There you
sorry.
go. Good.
So, one of the questions I do have that since I'm taking this medicine and there's always that risk, should I be getting x-rays and that more often, or should I just stick with what my dentist is doing? And how often, you know, do we get these? Because every time I go, I think I just did that, but I lose track. And now I don't know if I should be, you know, and also I have not been doing the fluoride, you know, gel, because I didn't know if they were just trying to upcharge me. So if you could give recommendations, since I am doing this medication and my bone, I've been doing well with my bone density, x-rays, etc., and the fluoride, if I should be doing these on this medication.
Well, as far as the x-rays go, typically most offices will say like once a year to have what they call like the bite wing x-rays, where it kind of gets the top and bottom of the back teeth to look in between for any cavities. And then maybe every 3 to 5 years doing a more complete series where they can see through up to the root tips in all different areas. That is a good idea to stay up to date on those, because again, if there's certain areas, especially like in between the teeth where the teeth contact each other, that's where a lot of people become really susceptible to getting cavities. And if one starts in there, we can't really see it without the x-rays unless it gets bigger and if it gets to a certain point. So ideally, if we find a cavity on the x-ray, we can fix it and keep it more conservative versus the larger it gets, then it's the more, the larger the restoration has to be and the more assault to the tooth that happens basically. So staying up to date on your x-rays is good. The fluoride, I think fluorides are something that they help to keep your teeth strong. So any time that you use the fluoride, I think it's a good thing to help keep your teeth strong and healthy and prevent the cavities from occurring. Because again, you don't want to have cavities occur that could lead into anything further with a tooth, that all of a sudden a root canal, a crown, an extraction, you know, all these different things that you just want to avoid it if you can.
Can I ask a question though? Do most insurance coverage pay for fluoride for adults? Do you know? Just off the
That
top.
just
mean,
depends
I feel
on your plan,
5K,
really.
But I feel
Mhm.
like taking my 13-year-olds, I always end up paying an additional charge for fluoride, which I'm fine with, but that might be a consideration just to check that all out if, it's a concern.
Definitely. Yeah. And that's
As we all know, breast cancer is very expensive.
Mhm.
And I would imagine.
exactly. That's that, and it's always weighing the risks and benefits of everything, or the ups and
Right.
downs, where sometimes that small investment is going to pay off by preventing the big filling charge or
Right.
anything further down the line. So
Yeah.
Yeah. All right. Well, I want
All
to
right.
switch gears and talk about another big topic related to chemo treatment specifically, and that's mouth sores. So we had spoken with you earlier on our prep call about how some of the fast fixes that we're told as breast cancer patients are not always great when it comes to dental health, such as like Jolly Ranchers and lemon drops. Can you talk about some of those things?
yes, so some of the things, just like I mentioned before, sometimes there's products that are on the market that may not always be the best for your teeth long term. And some of the remedies that are recommended to patients during the cancer treatment process, from a dental perspective, have always just like made me cringe. We definitely are not on the same page as our medical providers sometimes. So like you mentioned, Jolly Ranchers or lemon drops, that is a really common recommendation for people to remedy their dry mouth issues. And of course, it will give you that immediate feeling like, oh, I'm salivating, and now this is helping to relieve some of that discomfort. But unfortunately, because a dry mouth is so much more susceptible to cavities and problems like that, having that repeated exposure to an acidic, sugary substance like a candy like that is just a recipe for disaster. And so that's, I think, a lot of times where, when we talked about people come through and treatments, they're like, oh my gosh, I have all this damage done to my teeth now. Sometimes it's because of using these things, trying to reduce the symptoms that ended up causing more damage down the line, like the candies like that. And on the upside, there are some candies that are have an ingredient in them called xylitol or erythritol. There's a natural sugar substitute that's made out of like fibrous materials like corn cobs and birch trees that actually can help reduce the harmful bacteria in your mouth and keep what's considered more of a healthy microbiome to protect against cavities. Another thing that sometimes can be recommended, which actually shouldn't be an issue with causing long-term problems with teeth, but with mouth sores, they may suggest sucking on something cold, like an ice pop or something like that. So if you're doing one that's a sugar-free ice pop, that should help to avoid some issues. But if you're sucking on a lot of like sugary popsicles or things like that, the concept of why they recommend that is that for certain chemotherapies, if you are sucking on something cold, it helps to shrink the blood vessels inside of your mouth. And that prevents the same amount of medication from reaching those tissues. So that can sometimes help to reduce risk for mouth sores. And now the same concept's being used to help people hold onto their hair during treatments with things called cold caps. And another one that we talked about is magic mouthwash. That is kind of a standard. It's for a lot of people as they're going through treatments. And there's different recipes that go with that. And a lot of times they have a coating agent like Maalox, Milka Magnesia. Sometimes they add a anesthetic like a lidocaine or something that'll numb the tissue. And sometimes they'll have like a diphenhydramine, which is an antihistamine, anti-inflammatory. And for some people, that is just a saving grace. It helps to remove that, tenderness from mouth sores. It helps to keep eating more possible. But I've also attended webinars where they talked about giving magic mouthwash to help with dry mouth. And I'm like, there's nothing in there that's going to help with dry mouth. And sometimes people have side effects with magic mouthwash concoctions as well, where sometimes people will notice that they do have more dryness. They have burning of the tissue, taste changes. Sometimes people have gastrointestinal distress in some way with it as well. So it's something that it definitely has its place, but it sometimes just seems like it's just given out as a knee-jerk reaction to people. whether being more specific to, is this the best choice for what they need right now?
Hmm. Thank you. That's helpful. I know I slept on Jolly Ranchers, but it wasn't so much because I had dry mouth. It was because somebody told me one of the medications that I took caused my mouth to taste metallic. It had like a metallic scent. And so it just sort of helped offset that, having something else flavored. I guess I was fortunate because I didn't come out of there with a lot of cavities, but I know people have a lot of trouble with mouth sores. I mean, it's a real problem.
No,
It's a
I
real
had a lot
thing.
of mouth sores. Yeah.
Did you?
I did.
Yeah.
Yeah.
Okay, we are wrapping
All right.
up on time. So if you have final questions, please put
Yeah.
them in the chat or raise your hand now.
Yeah, final questions. I think we'll do one more topic and then we do have to move on to our drawing and talk about next month's
Yeah.
topic. Anyhow, so the last topic we were hoping to chat about was your recommendations in terms of the connection between oral health and general health. I know this is a really important topic.
Yes. So there is something called the oral systemic link, that there are so many amazing discoveries coming out with this. It's one of those things where for many, many years, we've known that there's some kind of correlation where people who have more disease in their mouth, especially with gum disease, tend to be more susceptible to certain other medical issues, like they have higher risks of heart attacks and strokes. There's more risk for pregnancy complications with preterm or low birth weight babies. There's more risk for diabetes. And now, actually, in the last couple of years, they have made a connection between certain oral bacteria and Alzheimer's disease. So it's really interesting that now they're breaking down, like, what are these connections? And they're actually finding specific oral bacteria that either put people more at risk, like if you have an abundance of that type of bacteria, and other bacteria that seem to have protective factors. So it's amazing. We're still at kind of that cusp of figuring out how to harness that information and then use it in order to, figure out who's most at risk for some issues, who, and what do we do about it? Is that a way that we can find out better ways of early detection, or possibly better treatments to help get more successful? Because there's actually different cancers now that they are relating to certain oral bacteria as well. They found oral bacteria that's real common in periodontal disease called Fusobacterium nucleatum, actually embedded in colon tumors. And they feel this has something to do with the aggressiveness of the tumors. There's an oral bacteria that they have found in certain breast cancer tumors called Porphyromonas gingivalis. And so it's going to be interesting where this all leads. And it's really cool because there's now ways that people, you can have your own oral microbiome tested. Some dental offices offer this through the office. Otherwise, there's tests you can do at home now, where it's basically, it reminds me of what I've never done one of the 23andMe tests, but this is what I picture it being, where you just collect saliva, you send it in, they analyze it, and they send you back a full report of exactly what kind of bacteria and the prevalence of them, and then can give you more specific, personalized recommendations for helping to improve it, and helping to, whether it be oral hygiene habits, product selection, dietary changes, and helping to nurture the good bacteria that help to overpower the bad.
So do you think there'll be like probiotics that people
There
will
are.
take for like dental health at some point?
Yep, there are actually probiotics, and they're little lozenges that you can just suck on and let dissolve, and it helps to replenish certain beneficial bacteria inside of the mouth. So, and yeah, it's something that especially people like sometimes will say, oh, I just never have that fresh feeling in my mouth. And it's amazing. Sometimes you start using some of those probiotics and it's like, oh, I have this nice minty, and it's just working with that natural oral microbiome. But that sometimes is tricky too, because that's, I think as time goes on, they'll be able to create probiotics that are, again, more specific to people's needs versus just having a general one.
So cool. I was
Okay.
telling Lynn before we got on, since we started the call talking about our shared love of dogs, I'll just tell you that our veterinarian and I just had this conversation about my older dog, because he was like, you want to make sure you take care of their teeth, because there's all this research even in animals now that's showing like the oral health is correlated to the general health. So that's fascinating stuff to me. Okay.
And you might be interested to
gonna do
know,
the
there is a
drawing.
probiotic for dogs' mouths
Is
as
there
well.
really?
I can
Oh,
send
my
that to you.
All right,
Oh my goodness.
I'm gonna read the names I've got. If you're here and I don't read your name, please speak up.
Mhm.
Dawn, Sue, Jackie, Carrie, Leslie, Whitney, Mac, Jerry, Mary, Jenny, Ella, Rita, and then Candy, who was here and has left. All right, anybody, did I miss you? Did I miss you? Okay, we're gonna do
So we're
drawings.
in a very,
She's
very
shaking 'em.
fancy Tupperware container, because that's how we roll. All right, Lynn, you do the honors.
All right, I'm gonna put
This
it
is
up
completely
here.
random.
All right, I got
Hope you can
it.
read my handwriting. I was
Okay,
writing it down.
let's see. Jackie,
Jackie is the
All right,
winner.
Jackie.
Congratulations,
if you will
Jackie.
put your email address in our chat, we are going to email you a $50 gift card, courtesy of the UPS store, Fieldstone Farms.
All right, thank you guys for joining us today. Next month, I'm gonna let Lynn tell you who is gonna be our guest speaker, but it's on Wednesday, May 22nd from 12 to 1. We would love for y'all to come back and join us on Wednesday, May 22nd.
Yes, we're going to have a representative from Natera. We will be talking about genetic testing for hereditary cancers. It's a really fascinating topic. As most of us know, breast cancer does have some correlations to genes. And so she's going to talk about the Empower genetic test that Natera sells. And she's just going to discuss some current recommendations for genetic testing. So I think it'll be fascinating. We hope that you all join us.
Please do. Thank you again, Jill.
All right,
We are
thank
so
you.
appreciative of all your expertise.
We
Thank you
will
for
you.
sharing
Thank
with
you.
us.
It was
And
great spending time with you all today.
thanks so much.
Bye, everybody.
Goodbye.
Bye.
Thanks, ladies.
Thank you.
Thank you.
It's not gone, don't worry.
Okay. Thanks. Sorry.
Thanks again.
Thank you.
Thank you. I'm trying to figure out how to. Well. I don't know what happened, but I had, oh, here we go, Zoom. There it
Oh,
is.
thank you.
Okay, I was like, I know how to find it. Okay.
Okay.
So,
All right.
love this meeting.
Great.
How do we get to Jackie?
Scroll up. There was like 8 things in there.
Okay.
I'm like, I don't know why I have such a problem scrolling, and I think it's up or something. I'm afraid to mess it up. Okay, let's see.
Well, Candy, she was after Candy, right?
Yeah. All right.
Did
well,
you submit it? We can look it up on her,
Okay.
on her RSVP.
All right, Jackie. Right. All right.
Let me just stop the video.
Oh,
for a
we
second.
look good. Wait, are we still there?
No, I was gonna end the call.
No.
Do you want
Well,
me to?
can you go back?
Mhm,
Us?
mhm.
Let's do a banter screen print. We could do it as a story sometime,
How
right?
do we do that?
I don't know. Can we do a print?
Like a picture?
Yeah. Do you know how to do a screen print?
Not on my laptop.
Hmm.
I know how to do it on my phone.
Let's try and think it. I have a screen print icon that mine just doesn't. Let's see. So look up. Oh, but it's showing us. I can't do it.
Oh,
Huh.
we can take a picture from our phones.
Yeah, we could. Okay.